Hello, everyone. Thank you so much for joining us tonight. My name is Todd Lotchpike. I'm the Director of Employer Relations and Engagement within the Shavet Glaback Center for Career Strategy and Professional Development, otherwise known as the Career Center. But we recently got the gift from the Glaback family, which we're very fortunate for. So tonight's event is Exploring Careers and Fields in Health. We're very excited to bring this to you. We've gathered some excellent and very successful alum in several different fields, and I'm sure that tonight's going to be very, very informative. Just some housekeeping issues. If you are comfortable doing so, please do turn on your cameras. It's much more beneficial for the panelists to be able to see you as the event goes on, as opposed to looking for a black square. And also, if you have any questions as the event goes on, please feel free to simply raise your hand virtually using the raise your hand feature in Zoom, or physically, and Jeff will see you, or a moderator will see you, who I'll introduce you in a second. Or you could also just send them to me directly in the chat, and I'll make sure that they're communicated to our panelists at the end of the night. So without further ado, I'd like to turn it over to Mr. Jeffrey Mullen, who I'm sure most, if not all of you already know. He's going to be our esteemed moderator tonight, and we thank him for that. So with that, I will turn it over to Jeff.
Okay, welcome everyone. Thanks of course to our panelists for taking time out of their busy schedule to join us tonight. As I know a lot of you already, my name is Jeff Mullen. I'm full-time faculty in the Stern College Biology Department. I teach Human Anatomy Lab. I'm also the advisor for students interested in nursing, physician assistant, occupational and physical therapy. And I've met with several of you already. I've put my email address in chat in case anyone has any questions or would like to contact me. And I've been the advisor for pre-health advisor since 2010 in these fields. And I've been at Stern since fall 1999. So just to give you some background. Okay, so let's get started. I just first will have the panelists introduce themselves, tell some of their background, what they majored in at YU, or where they went to graduate school, what their current position is and current affiliation. Okay, so I guess we'll go alphabetically. Let's start with Danielle Amster, please.
Hey, hello everyone. My name is Danielle Amster. I work as an occupational therapist. I went to Stern College. I graduated in 1998. And at that time, I went to Columbia University for their School of Occupational Therapy. I've worked in many places over the last 20 years. So I've worked in schools, I've worked in early intervention in homes and private practice. And right now I have a private practice in New Jersey, and I work with people of all ages, from small children through adults, with a variety of things, which I think we're going to get into in a little while. And that's it.
Okay, Jason, do you want to go next?
Sure. My name is Jason Pariser. I'm a clinical manager at the University of Pennsylvania Health Systems. I graduated from YU, I think it was 99, 2000, around there. I was actually a business major, so I have an undergrad in business management, and I've been working in healthcare for about 10 years or so. As I finished undergrad, I was in the business world for a couple of years, and I decided that really wasn't the best avenue for me. I wound up going to a second undergrad and then a master's degree from Drexel University.
Okay, Elizabeth.
Hi, everyone. My name is Elizabeth Slosny. I'm a PA. I went to Stern and graduated in 2015. I majored in biology with a concentration in neuroscience. I then worked at Stern for a year while I was applying to PA school. And then I went to Mercy College for about 2 years. And I've been working at Montefiore Medical Center for about 2 years now. I work in the internal medicine department. So that's just the general floors of the hospital. So I have patients who are just social and need nursing home placement. And then I have patients who are overflow from the ICU who have vents and blood pressure support and all of that. So yeah.
And Michael, Helene, I don't know who wants to go first.
Go first. Okay. I'm Holly with Satowski. I went to Stern. I graduated in 2015 with Liz. And then I went to Hunter College for PT for 3 years, and now working in an outpatient clinic with kids and adults. And I also work part-time in a school.
And Michael?
Oh, and I majored in biology and economics.
My name is Michael Satowski. I went to YU. I graduated in 2014, and then I went to Touro College for physical therapy, and I graduated in 2018. I'm working as a physical therapist the last 2 years, two and a half years or so at Mount Sinai Hospital on the Upper East Side. I work in the I'll talk about more later, but basically I work with people in the hospital, people from the ICU all the way to discharge and going home. So yeah.
Okay. Are there any questions thus far from the students? Okay. So we have sort of a set list of questions that we're going to go through. All right. The panelists have seen them before. So the first question for the panel is, did you know you wanted to pursue your specialty when you first entered college? I mean, was that your choice, or did you switch paths on the way? And if there was your original choice, what drew you to that particular field? And what did you do as an undergraduate student to prepare for your career choice? And for those who didn't start out on their current path, when did you change your path, and what led you to that decision? So let's see, who wants to start? Elizabeth, you want to start?
Sure. So I did not know I wanted to be a PA. I knew since high school that I wanted to do something in the sciences. I wanted to help people. It was like that sort of middle ground. I think I went into Stern thinking I wanted to be a neuropsychologist, hence like my concentration in neuroscience. But then I sort of had thought where I was like, okay, like what did I want to, even though I was intellectually interested in it, I wanted to know what I want to do on a day-to-day basis. And I knew that I wanted to be talking to patients. I wanted to be treating them. I wanted to be involved in medicine. So I eventually sort of landed on PA because I thought like that would be the best avenue for me to be able to do that. The other questions? Yeah, as an undergrad, I mean, I took the required courses in order to be able to go to PA school. In addition, I also worked in doctor's office. And over the summers, I would work as like the camp nurse for a little bit. I would also make sure to shadow a lot to make sure that I knew what a PA was and what they were doing. And that was how I decided that.
Okay, thanks. Michael and Helene, do you want to go next, please?
Okay.
Okay, yeah. So I think I went to YU, sort of interested in biology or the sciences, but I wasn't so clear where I was going to go with that. I think one summer I went to Camp Ask, and I just got this is like my first experience of like seeing physical therapy, and I think things like that sort of got me interested in the field. And I think what the specific aspects that interested me was like they get to have direct patient care, and you get to prove others' independence, and sort of a lot of people have these like some people in physical therapy are often seen as being disabled, and you sort of breaking those stereotypes, and that kind of drew me to the field. And I did some volunteering, some shadowing during the summers, and then that kind of pushed me in that direction to eventually apply and take all the required courses. So.
And I also, when I started out in Stern, I also liked science. I always wanted to go into like something with health. I was really pre-med, and then I spent like my summers volunteering in a different hospital, and I realized like doctor is not for me. I really felt like I wanted more of that patient care interaction. And I've been like dancing for a long time, and someone had like suggested like, oh, like what about like PT? I had gotten PT for some injuries, and I realized like physical therapy is a big aspect of it is like movement based, and seeing like people's quality of movement. I realized like, oh, that's a really nice way for like me to still have that science background, but have more of that patient interaction. So it was like my last year in Stern, I think I decided I was going to go into PT. So most of my courses with biology major, I like had the prereqs, and I just had to say, I like applied. I took a year off because I had to do like some volunteering. I actually volunteered at Bellevue. I know it's like a popular place for Stern, since it's so close by, in the physical therapy department. And then I also shadowed whatever outpatient clinics I like was close to my home.
Danielle, you want to go next, please?
Sure. So I'm going to admit this. So when I started at Stern, I said I am not going to become a therapist like everybody else. So that's really how I started in my decision-making process, was I'm not going to be an OT or a PT or a speech therapist or anything like that. So that's really the truth. But the truth is that I really, I was honest with myself eventually, because I really enjoyed understanding people and how they work, both from the physical side and the physiological side, the biology piece of it. And I really enjoyed also understanding more of the psych aspect of how people are. And this field really is a nice combination of the two. And so I was actually a psych major and a bio minor. And I did do some volunteering for all these fields. I think you do need to do volunteer hours in order to apply for graduate school. So I think we needed about 40 hours or so. So I also went very conveniently close to Stern. I went down to NYU, which was on 34th Street. They have the Rusk Institute, which is a big rehab facility. And so I did a lot of hours there. But that's really how I came to choose the field, is because I really wanted to work with people, and I really wanted to have this more holistic view of people. So what's nice is that I really have found that over the years in this field, I have switched and shifted from different populations and different age ranges, and you really can use a variety of these skills to look at people holistically, whether you're in a rehab facility or working with a child who's having difficulty in school. So there are a lot of sciences, and there's also a lot of psychology classes. So it's definitely a good choice if you like the combination of that. It's also very nice. There's a lot of creativity in the field, and it leaves a lot of room for you to come up with innovative ways to help people solve their daily functional issues. So yeah, so that's how I came to the field. I think I also did some other volunteering things in the summer, because definitely when you're applying to graduate schools, the more experiences that you have and the more varied they are, the better it looks for you. So.
Thank you. And Jason, I think you had like the biggest career shift, so that's why I said you for last. Okay.
So I took biology and chemistry, mostly for business majors and people who were never going to set foot in a hospital ever in their entire lives. And I graduated with my diploma, and off I went. And then many years later, I had a family member who got very, very ill, and I spent a lot of time in a hospital, and certainly getting to know fundamentally what goes on in the hospital, like what the nurses do, what the physical therapists do, what the rehab facility people do, and just getting a better understanding of, it's not just a one-to-one ratio, and it's not just providing care to a patient, it's providing care to a family, and it's not just one person directing their care, it's everyone moving their care forward, and what quality management means, and all these things, and what safety means, and getting a global picture of how things run in a hospital. So what's interesting about my pathway to where I am now is my business degree was imperative to where I am now, because one of the parts of my role is you need a business degree to do my job. So in a certain way of looking at it, you could look at it and say, well, getting an undergrad in business was kind of a mistake. Well, it absolutely was not. I didn't realize it at the time, of course, but in order to get to the role that I have right now, you have to have an undergrad in business plus, and then you go into the nursing degree also. When I shifted over to nursing, it was a surprise to all of us. It was kind of one of those things where like, it was so off the radar. But it was the first time where I was able to feel good about what I was doing for a living, and also provide care and basically feel good about being able to affect someone's life in a positive way. It wasn't just about a balance sheet in an office someplace. And as you move forward in that environment, and you see how you can improve quality metrics, not just for balance sheets, but also to provide a safer environment for a patient, and have positive outcomes based on things you're doing and things how you can move your team to do, that makes it all the more meaningful. And to mirror what other people have said in this chat so far, one of the nice things about not going to the doctor side of things, staying on the nursing side of things, you don't necessarily have to specialize. Like if you go into the physician side of things, you usually specialize in like cardiology or family medicine doesn't really do that. But like if you specialize in a certain area, you're kind of landlocked in that area. So someone like me, that would not be the best fit because I kind of like to move around a lot. But most people, if you specialize, that's kind of where you're going to be for the next 40, 50, 60 years. And if that's for you, terrific. But with nursing, you can kind of shift gears a little bit, and you can kind of like be in neurology one couple of years, and you can go over to oncology for a couple of years, and you can kind of find your right fit because your skills go with you. And sure, you have to fine tune where you're going to be, but for the most part, your skills are very transferable around the hospital system.
So they ask Jay, because I know students always think once they become an RN, the only next step is to become a nurse practitioner. How does a clinical nurse leader or manager differ from a nurse practitioner?
That's a really good question. So in terms of sports, the clinical manager is kind of like the team captain. So that would be the kind of person who basically manages the team and kind of drives outcomes forward by being like the leadership role of the team. A nurse practitioner is a nurse who's able to write scripts under the auspices of a physician. So they have an agreement with the physician, and the physician says, I now trust you enough to write scripts under my name, and they can write prescriptions for patients, and they can also bill to Medicare, I think, also in insurance companies. So it's two very, very, very different career paths, especially, I mean, down where I live. I'm not sure how it is in New York, but that's how we view things in the Philadelphia area. The clinical managers, it's much more on the business side of things and much more on the team-driven area.
And I guess I know the question I always get when I meet with students is, what's the difference, I guess Elizabeth and Jason can answer this, between a nurse practitioner and a physician assistant? I mean, I get asked this all the time. Could both of you maybe elaborate a little on the different responsibilities of a PA versus a nurse practitioner?
Sure.
So, I mean, I don't know if you want. So, I mean, a lot of the difference is mostly comes down to the educational route. It's basically nurses go through nursing school, and then usually they'll work for a couple of years. Sometimes they're direct programs, but usually they'll work for a couple of years. Jason, pipe in if I get anything wrong here. And then they'll go to NP school, which is usually like they'll choose like pediatric or family medicine, or it usually choose some sort of specialty. And then you work as a nurse practitioner from there. For PA school, it's more from like the medical diagnostic model. So it's like a mini medical school basically. And you go usually straight from undergrad to PA school, or it's a second career and you go to PA school from there. And that's sort of the model. And then I guess like a lot of times, let's say NPs can usually work more independently. PAs, you have to have a doctor sign off on what you do. Now, depending on the job, sometimes certain doctors will just like sign off at the end of the day, maybe come to the practice once a week. And you'll also find that a lot more PAs will be in, let's say, surgical specialties. Versus, let's say, I have a ton of really great nurse practitioners at my hospital who are, let's say, in palliative care and those sort of fields. And we have more of like but that's my particular hospital. And then we have a lot more PAs in the surgical specialties. So it's really mostly about like the educational route that you want to go down and where you want to put your focus.
Yeah, and certainly to mirror that, it definitely comes down to the education. So the NP track goes by way of nursing, and the PA track goes by way of medicine. And you know that there are commonalities, but it's definitely from where you're getting your degree from. And certainly the NPs are much more acceptable as far as when you have a physician's visit. If a viable choice to see somebody at the practice could be a nurse practitioner. That's one of the things that we see in American culture as far as a doctor's visit. You can go see a nurse practitioner. You probably have not seen a physician's assistant when you go to the doctor. That's one of those things that hasn't really taken off in this country just yet. Doesn't mean it's bad or good, just means that's the reality of what it is. So it's depending on what you want to do with your career, that would dictate how you want to get educated, I guess.
All right. And I know the other big question I always get, and this will be for Danielle and Michael and Helene, what's the difference between occupational physical therapy? How do you work together? Like a lot of times when a patient has rehab, they have occupational and physical therapists on their team. So like, what are the similarities and differences between OT and PT? I don't know who wants to start. Danielle, you want to go first?
Okay, sure. And feel free, Michael and Helene, to jump in. I feel like this is always the commonly asked question. I remember in OT school, it was like the first question that they asked us that first semester over and over, like, let's try and understand this. Truth be told, after 20 years, I feel like there's more overlap than I would ever have imagined because we have one body. And so there is a lot of overlap because, but I do think that the mindset is a little bit different in the schooling. So the mindset, I'll speak more to the OT piece, and then maybe Michael and Helene, you can juxtapose it with the physical therapy perspective. The OT perspective is definitely function, function, function. It's very, very function based. So it's a lot of problem solving and a lot of creativity. So let's say you have a patient who had a stroke, you might have let's say, a young mother, if she only has use of one arm now, we're thinking, how is she going to diaper her baby? How is she going to wash the dishes? We're going to try and problem solve more from a function end, as opposed to just improving strength or coordination, things like that. But I would say that it is very heavily informed by all of the same science. I know when I went to OT school at Columbia, I don't know that it's still like this now, but we had a lot of classes joint with the PT department because a lot of the basic classes, understanding the various systems of the body, are an overlap because it is one body. But definitely there is more of that function-based piece. The other difference that's quite large, but not necessarily significantly playing out in the field, is that there is a very heavy component also in the OT field in terms of mental health training. So it's not just about physical disabilities. There's also a lot of training in the mental health world. So I myself work in a very strong combination of the two. Like my practice focuses on understanding the way that the body processes things and the way it affects us emotionally. So I work with a lot of people who have mental health disorders like anxiety or PTSD, learning disabilities, processing issues, things like that, but use my understanding of the way the body works to help inform that treatment. So it's definitely, the field of OT, I think, is a little bit more expansive in terms of its reach, because we will look at whatever the functional goals are, no matter how far reaching they are. And I know classically it's always said the OTs do the fine motor and the PTs do the gross motor, but who gets the middle? I don't know, but there's definitely a lot of overlap. And a lot of the PTs that I have worked with, I'll do things also with the lower extremities, and they'll do things with the upper extremities. So I think it also depends on, people's individual biases, but there's definitely differences in the training. Definitely PTs are much more focused on mobility and movement patterns than the OTs are. So it's definitely a lot more concrete in that way. I hope that was helpful, but you should feel free to ask questions.
And I just want to ask one thing. They've been saying for the last 10 years that in order to do OT, they're going to switch over to, you need a doctorate. Like when I started out, like most of the physical therapists had a master's degree. Now it's pretty much mandatory. You have to get a DPT, a doctor of physical therapy, to practice. Have you heard anything about the trend towards a doctor of OT?
In the OT field? So definitely, when I was in school, I was in OT school from 98 to 2000. So all the programs were master's level programs, but I will say a lot of the practitioners in the field who I was observing and learning from had a bachelor's degree. So it had shifted shortly before me into master's. We're always like 20 years behind the PTs in terms of this type of like academic achievement. So I had friends when I went to master's program, I had friends that were starting DBT programs in the PT world. Right now, there is a shifting towards going towards a doctorate, but there's been a lot of pushback. And so some of the programs that were actually looking to move into a doctorate pulled back towards a master's program. I know that YU's opening up, I believe this September, a doctorate program. And if you're opening a new program, it definitely pays to go that route. I know Turo was intending to start a doctoral program this year, but because there was so much pushback, they actually reverted back to their old curriculum. And after having redone the entire system, from my understanding, don't take my word on this, investigate on your own. But I do believe there was a lot of pushing back because in the field, truth be told, it doesn't really matter the type of degree you have. My experience personally is that no matter what degree you have, whether it's a bachelor's or master's or a doctorate, the pay scale is the same. And a lot of the doctoral programs do cost more because it's longer. So I don't necessarily advise people to go for the doctorate, although it is pretty cool to have. And if that's interesting to you, also if doing research is interesting to you, definitely both the fields of PT and OT could use more research. Definitely the field of OT. Not many OTs go into it for research. Most people go into it to be out there with people. So if you are interested in that, definitely go for the doctorate.
Okay, thanks. Michael and Aline.
Okay, so I think it, like really like a good grasp of the fact that there is a lot of overlap, and I think it depends partially on what setting you're in and certain people's viewpoint. Personally, like I work with a lot of kids, and I think that there is a lot of overlap with the occupational therapist, just in terms of, again, helping the kid like achieve what they need to do and having that teamwork. And I think I definitely have learned a lot from working with OTs, just in terms of like that mental health aspect and some more of like that function based. I would say in PT school, we definitely focus a lot on function, but there is a little bit more like this understanding the kinesiology behind it and having that like movement pattern background. And I think that is really helpful for analyzing like what to do with the patients and figuring out how to help them. But at the same time, like at the end of the day, even though people are coming from different approaches, the end result is that we want to help people get back to what they were doing before. I would say that sometimes like people definitely like hear like the fine motor, gross motor, but in PT school, like we learn fine motor skills. I just think that it's not emphasized as much. Sometimes people say like upper extremity for OTs, and PTs are like lower extremity. I think that like should be thrown out, because I think, again, like we're looking at the whole body. And there's also, sometimes people say like, oh, like PT is like the heavy lifting and like walking and things like that. But again, I really think it depends on setting. And Michael, you could talk about like in the hospital base, like you're working on very different things, PT and OT, versus when like you're in an outpatient clinic. And I think something like occupational therapy and outpatient, at least like where I'm working right now, there's a lot of like the hand therapist, like that's like one route to go. But then there's also, we have like a pediatric OT, and then we have an OT who's specialized more in neuro. So I think even with like in these fields, you could specialize more into certain things and then have a different approach in how you're treating the patient.
Okay, thanks. And then the next question I think we agreed upon was, what is your typical day like? Like how many hours a day do you work? How many days a week? What is your work life balance like in your career? If you could speak like a little bit about what your daily routine is like on an average day, what you do each day. Jason, do you want to start this one, please?
Sure. So on paper, I work Monday through Friday. Typically it's from about 8 o'clock till about 4 o'clock. But that is not reality. The reality is that my day starts very early in the morning, and first thing in the morning, though, once I start working, I'm checking in with my staff, making sure that my team actually making sure that everything's going well, make sure my physicians have arrived in clinic, make sure the secretaries, the nurses, the social workers all got to where they're supposed to be going, and then I start logging into the system to see what's going on. Is the call volume out of control? Do we have what we need to do our job today? That's the first thing. Then throughout the day, I'll have issues come up with either patients need intervention by a manager, or I'll have staff has an issue coming up where either they'll be like someone either gets sick, or they'll have a problem with a patient or whatever it is that needs a manager intervention, or a clinician will have an issue with a schedule of some sort that needs to be ironed out quickly. So that's kind of like a jump in moment for me to jump into that. Then we have operations meetings, which are basically like the financial meetings for the hospital. And are we hitting the financial marks that we have to meet for what we're doing? Then there's quality meetings, and what happened? Are we on? Certainly with COVID, that's all we ever talk about is the curve going up or going down, and what are we doing to help that? And, who wasn't wearing a mask but never seen having lunch or talking to their friends? So these are the type of things that we talk about a lot. I'm sure every hospital person who works in hospitals is understanding what that is. And then there's the back end stuff of getting an understanding of what the global team is doing. So for example, like patients are very often referred to my health system for care from other health systems because we're a top tier hospital. So you want to get an understanding of where these patients came from. and you want to make friendships with the people who are referring to us. But that's a lot of chart digging, and that's a lot of reading through to figure out where they actually came from. And this is, I work with the team to do that, to kind of like make sure they get the documentation they ask for, make sure the patients are registered for the tests they're supposed to be getting to. I actually get patients rides to the hospital sometimes because my patients can't drive. So my day does not end at 4. My day ends when it ends. I also manage a surgical program. So all of my patients have my cell phone number, and they will call whenever they feel like it. And that's fine. That this is just what you do when you're providing patient care. That's not a physical thing. I mean, certainly when a PT or an OT or anybody else goes home for the day, and certainly when I was bedside, when I'm home for the day, the bed's not here. I mean, you're home, that's it, it's over. But now when you're doing this kind of, and you're a little bit hands off, you have to provide that level of access to patients. And certainly the reason why they come to a place like Penn is because you are providing that access. So my job just does not stop.
All right, Danielle, do you want to go next?
Okay, sure. So one thing that's great about a lot of these fields, definitely, I think I can speak for PT as well, is that there are many options in the field for working variety of hours and locations and settings and populations. Some for myself, right now, I'm working full time. I have my own practice, so I set my own hours. So for me, I choose to work on Sunday and I take off Wednesday. Everyone has their own thing. But what's been nice is that when my children were little, now they're all teenagers and actually applying to OT school also. But you know, when they were little, you can work as much as little as you want in many of the settings that are available. So I did work in schools and I was able to work part-time. There were years that I worked 3 hours a day, 4 days a week. And there were years that I did 4 early intervention cases. There's a lot of flexibility in the field. Definitely if you're working in a hospital setting or in a rehab-based setting, a skilled nursing facility, places like this, it's definitely more rigid hours. And less flexibility, longer hours, but there is a huge range in the field. And I've worked with many people, males and females, who, let's say they had a school job during the day, but they wanted longer hours and they worked in a practice in the evenings or on the weekends. And I've also known people who wanted to just take off for a little, they had children, but they wanted to stay in the field. And they worked for an hour on Sundays just to stay in the field and not ever feel like they left and had to come back. But there's a lot of flexibility to kind of play around with that depending on the area that you're interested in. And I'll say the salaries are also, it's the same wide range depending on the setting that you're working in. But definitely I find that there's a lot of flexibility. I mean, now that I have my own practice, similar to how Jason was saying, if you move into a more management position, I would definitely say most of my work is client facing. I see many clients a week, and but there is a little bit of management piece. So that piece doesn't always end if you choose to go that route. But again, like for the first 15 years that I worked and my children were little, I didn't do any of that. I went to work, I came home, and it was over. So there's definitely flexibility to move in and out of different areas of practice as well. You know, I've known many people who worked in hospital settings and then decided they wanted to do school-based therapy. So you can play around with it, and there aren't really any requirements in the field. I think PA might be different in terms of what we're doing here in terms of shifting. I'm not really sure, but you can shift without, you know, you can take continuing ed on your own for your own level of comfort, but there's a lot of flexibility.
Hey, Elizabeth, you want to speak about your hours and your schedule and so on?
Sure. So mine is a little bit different. PAs can work in a variety of different settings. I mean, you can work in a hospital, you can work outpatients. A lot of people actually work in administrative roles. I work in a hospital. I work 3 12-hour shifts a week. But the way I like to do my schedule is I actually do 1 24-hour shift a week and then a night shift. I really like it because basically I get to spend 6 out of 7 days a week at home with my daughter for the majority of the day. So I work full time and I spend most of the time at home. So the way my shift breaks down is usually I get there, I sign up for the night team, find out what happened to my patients overnight. Then I go to the computer, I look at all of the labs and I look at the vitals and I just look through and get to know them a little better. Then I go in and see my patients. get to know them. And then I meet with the social workers and the nurses, and we have rounds where we talk about what the plan is overall with the patients, any issues we need to address, how we can help them both in the hospital, and then once they're in the hospital, making sure that there's like a safe way for them to go home. And then after those rounds are over, we speak with consults, we place different orders for imaging and labs, and speak with the families and address any acute issues. Things always happen in the hospital. And then usually at night, it's mostly just dealing with anything that comes up, as well as the patients will be admitted to the hospital. And so I come in, I evaluate them, I come up with a plan, I place orders. And that's pretty much how my shifts go.
Okay, thanks. And Michael and Helene, I think you might have a unique perspective since you're a married couple and this both in the same career. How do you balance your schedules and, work and home life?
Okay, yeah. So I work at Mount Sinai Hospital. I work like 5 days a week. I do some weekends, but it's usually like 8:30 to 4:30. And we have a 1-year-old daughter, so it's a little bit. That's the new thing. That's a little bit difficult, but it's great. And yeah, because since we're PTs, we kind of like look at our daughter and we evaluate her. But and it's serious. Yeah, so I go to work. I get like a caseload. I work in a cardio. It's mostly people who had heart surgery or people are going to have heart surgery or they're in the ICU. So I see sometimes really sick people on ventilators, and with COVID the past year, I was there for some of it. And so a wide range of patients, and I have to, the physician assistant or the nurse practitioner, the doctor places an order. I go see the patient, I write my notes, I make a discharge plan, I talk with a social worker. Sometimes the patients are there for a very long time. So then you just try to get them ready for rehab, or you try to minimize any long-term debility. And yeah, you talk with the family and you hopefully get them moving, and you have to work around all the medical team and the staff and any other things that go on. And so there's quite a range of things happen there. And
so I work part-time in 2 jobs. I work in an outpatient clinic for 30 hours a week, 3 days. And I also work in a school part-time. So, coming back from Jason, what you're saying is that like, yeah, once you see your patient and you go home for the day, you're done. Sometimes when you're working in outpatient, you have, and in all these settings, you always have notes to do. I usually have notes when I come home after work. So I would say that like I work an hour or 2 a night after that. So I'm working pretty busy. I see like between 15 and 18 patients a day. In my outpatient setting. It's like some evaluations and mostly just treating the patients. And then in my school setting, it's a little bit like not as intense. I see the kids for 30 minutes. I usually get home like around 6.
Yeah, I have no notes at home, so it's a little bit different. Yeah, that's something when you're in the hospital, you don't usually do notes at home, but
they usually give you like the time during the day. For outpatient, like depends on how you work. I like to talk with my patients and really work with them while I'm seeing them. So I usually have to do my notes afterwards. But still, there's a lot of flexibility. And before I was working full time in my outpatient clinic, and I felt like I just wanted to change settings. So I got to add on. They were very flexible with like adding hours, taking hours out, and stuff like that, which is good.
yeah.
All right, and thank you. And just to Jonathan, did you feel that your graduate training prepared you for your job, or did you learn a lot of what you do, on the job? I guess whoever wants to answer that, like when you graduated from your professional program and you started working, did you feel that you were ready to go right in, or did you feel that you had to learn a lot, on the job, that the graduate school prepare you for what you're doing now? Whoever wants to take it.
Right. You go.
Okay, thanks, Danielle.
But I'll go quickly. Sorry, just I only graduated from school a couple of years ago. I would say that when we have 4 different clinicals in school, so then you're working like in your setting for 8 to 10 weeks. And I feel like that's where you really get to get a lot of that clinical knowledge and understanding. I think in any school setting, you have to have some background understanding of what you're doing. And I think my school like generally prepared me for that, but definitely learned a lot from like being in my clinicals. And then when I started working, at first I remember I was like, I can tell patients I just graduated. Like, what am I doing? But you gain a lot of confidence, and you have to understand that like even though even if you're just starting to work out, you know a lot more than what patients know. You had schooling and alongside training and understanding. And I definitely say, like, I refer back a lot to what I learned in school, but when you start working, you get like a much bigger approach and more like also like that collaborative treatment aspect that you don't necessarily get in school. So,
Yeah, I could say it quick. I mean, yeah, so when I graduated, they didn't really teach so much about working in a hospital. So you kind of apply your physical therapy knowledge to the hospital. So like when I went to the ICU setting, I didn't know anything about that. And I don't really feel comfortable being there to be so a lot of the training was being on the job, and being there as a student helped a lot. But yeah, there's always new things to learn, and yeah. So it's always a challenging side, and sometimes the medical staff looks at you as if you're the rehab specialist, but the person is medically unstable, and you have to make that call to be like, I'm not seeing them today, or I'm going to come back later when they get the medicine, or they get the intervention, or they have the surgery, or we'll figure it out later, or we'll talk with the team. And then we'll figure out a plan how the nursing and all the other staff together can optimize the patient to really, get the most benefit from the therapy. But that takes some work.
Okay. Anyone else have any insights?
I'm happy to share. Definitely school it's a lot. I think we'll all agree. School is a lot. There is so much to learn. And I remember feeling like I was breathing part-time a little bit at certain points because there's so much to know. But at the same time, as you are so heavily prepared in so many areas, when you start to work, you start to realize that that was really just the beginning. So much of the learning that happens, I can speak for the field of OT, but it's probably similar in all fields, not just even in health sciences. You learn on the job, you learn from experience, you learn from watching the experiences of others. And I think probably in all of our fields, there's a mandatory continuing education to keep up your license. So I know as OTs, every 3 years, we have to get 30 credits. So, people generally, when they specialize in a particular area, they take courses and coursework, continuing ed in that area. So you learn more and more. And definitely in all the settings I've worked in, and I think this is true for most of the OTs that I know, like the other therapists are usually willing to and happy to collaborate with each other and help each other and get ideas. But definitely, we have also the same clinical type of field work, 8 to 12 weeks. You have a few of them, you have short ones, you have long ones, but if you have some great, clinical experiences in a rehab and in a nursing home, but then you take a job working in a school, it's a whole new thing. But that's part of the fun. That's part of the fun, is that you get to take the skills that you learned and apply it to all different areas, because the basics, like you're saying in PT, it's the same thing in OT. Like you take, or I think you said this with nursing, actually, Jason, like you take your skills and you move on with it. So it's working with people, it's understanding how the body works, understanding how the mind works, understanding how function works, and kind of analyzing all of that and applying it to different settings. And the fun is that the learning never ends, and the more that you learn, the more you realize that you don't know. So, but definitely graduate school is a lot, and it should prepare you pretty well to get started.
We do have some questions from students. Todd, do you want to
Sure, actually,
bring those
I have
up?
several
Or,
here. Let me just pull them up.
or I see Shira is raising her hand. Shira, do you have a question?
Yep.
Shira Kuznets.
Yeah, thank you so much for hosting the panel and everyone who spoke. I had a question concerning a little bit of a different topic than that's been discussed so far. I'm interested in OT, but I guess this question could apply to all the fields. But I was wondering if any of you had insight into how to find shadowing or internships now during the pandemic, since things are so different. I know that you're all established in your careers, but if any of you have family or friends who are looking or for those internships or shadowing opportunities during the pandemic, what advice would you give?
I'm going to jump in quick, but I'm going to let everybody else answer much longer answers. There was a big stop sign for all of this activity at my health system, and things are loosening up much more. So you definitely see students coming through every single day wearing student uniforms for all fields. And the experience of having hands-on experiences with patients, but with gown, mask, gloves, the whole shebang is back happening again. So don't be put off by the whole COVID thing. Take it seriously, of course, but the programs are back up and running to have students come in and help patients.
Okay. There were other questions. Howard, were you getting some questions?
Sure, I have a couple that I typed down here. First question, and I guess this would be for Elizabeth and perhaps Jason. Would you say that you have more responsibilities being a PA or a nurse practitioner? If anybody could have any could speak to that.
Well, I'm neither, so. Elizabeth?
Yeah, I mean, it so depends on your job, and it depends on what your responsibilities are. It's so dependent. It's really just kind of how you want to see your day to day and what you want to be doing. Yeah, the difference will really come down to what your educational, like kind of said earlier, it's really going to come down to educational route. That's the difference between them. And then, yeah, I'm not really sure how else to sort of answer that.
So I can give an example of someone who works with my team. She's a nurse practitioner. I work with an epilepsy group as a surgical program, and we see like tons and tons of patients. She's just become a manager. She has, I think, 10 or 12 NPs that report to her. She has a full patient load. She manages a pregnancy clinic. I mean, like her schedule is stacked. And and she has management roles. And she's responsible for budgeting, and she's responsible for quality, and she's responsible for all this other stuff too. So as you progress in your field, you're obviously going to start off at a regular rate where you're seeing patients every day, and you're doing the basic things that these two roles entail, where you're providing patient care, and going towards positive outcomes. But as your career moves forward, you can kind of direct it how you want it to go, vis-a-vis taking on more complex cases, more shifts, whatever it is, and then more responsibilities if that's the role you want to go towards. If you want to go towards a leadership role, if you want to go towards a higher responsibility role, or if you want to ultimately be fine tune what you're doing and stay bedside, which is also a very important role to do, that's fine too. But ultimately, you're going to be making that choice.
So,
Yeah, Leah, go ahead.
thank you so much for your answer. I just have a quick little question. What would you say that a nurse practitioner does in a hospital?
A lot.
All right.
So the NPs will see patients, not so much in the acute setting, but a lot of hospitals like mine, for example, have outpatient clinics that are very closely associated with hospitals. And Medicare, Medicaid, and the insurance companies have setups where after discharge, the patient has to be seen like within 15 days or 30 days, or we get like hit with a penalty. Them seeing the nurse practitioner counts. So there's a very heavy reliance on nurse practitioners to make sure patients are seen. And then there's only so many physicians and only so many nurse practitioners. So there's kind of this gap of getting enough patients into appointment slots. So if you have one more nurse practitioner, there's 100 more appointments a week. So they play an integral role in just getting patients seen.
When you mean patient seen, you mean like a PA would do? Like check what's wrong and like she can prescribe medication and stuff like that?
The same way you go to the doctor. So
Yeah.
if you had surgery, they can check the wound. They can do a physical assessment on a patient. They can refill medications. That they can do all that stuff.
I want to like how important, I'm sorry, is the graduate school that you attend? Like I have students, they'll get into say like Touro, Columbia, NYU, and they'll say, does it matter which school I attend? Like the people who do the hiring, like, does it matter if you attend? I know like University of Pennsylvania is the #1 nursing school in the country. I mean, how much role, how important is it like when you make a hiring decision, let's say like Jason or Danielle, what school the person graduated from, or do you look at their resume individually?
It's very important on the physician side. I know on the physician side, we are somewhat selective on what programs we'll take people from. On the non-physician side, experience does matter a great deal. I know for myself, my upper degrees are from Drexel, which I don't think many people from New York ever heard of. So if I showed up with that degree, people would be like, "What's this?" But in my area, Drexel's a huge school.
It's a good school.
So around over here, that's great. But I think if I came back to New York, they'd be like, "I don't know what this is." So yeah, I think it does make a difference. But ultimately, being able to walk into an interview and say I have this experience and I can talk about it, and certainly present myself with my data, that makes a very big difference.
So in the field of OT, I don't think, in my experience and the experiences of people that I've spoken with in the field, my colleagues, I don't think the graduate school that you went to as important as your personal skill, and I would say your interpersonal skills are very important, because this is a client-centered field, patient-centered field. People want to see that you're comfortable with people and that you like people and that you're willing to learn and you're willing to think. I think that goes much, much, much further than where you went to graduate school. I think there are only so many OT graduate schools out there. I know when I was applying from Stern, it was Columbia, it was NYU, and Turo had one location out in Dix Hills in Long Island that not many people went to. There weren't many options if that was for New York, the greater New York area. Now there are more, but I would say it's not as relevant the type of school that you went to as much as your personal attitude. What I will say is that I have had students that have come doing their level 1s, their level 2s during graduate school, and it's really more about the attitude. And there definitely were some students who came from the same school and, had not the greatest attitude, not the greatest interactions with people. And it's really more about, if you're in a place that's like that, that you are more personally just involved. But I don't think that the school that you went to is as relevant.
Okay, does any other students have questions for the panel?
I have a couple more that came in through the chat. Danielle, this one is specifically for you. What type of year-round or summer experiences should I be looking for, or should I be looking to have if I'm considering OT? Is shadowing in OT the only option, or what else might be out there?
I'm assuming this question is in order to apply to graduate school. So it definitely would have to, you definitely need a certain number. I know for COVID, they were waiving it. I don't know when they're going to bring it back, but you definitely need a certain number of hours shadowing an OT. Now, I'll tell you, when I shadowed, before I went to graduate school, I spent a lot of time at the copy machine, shadowing the copy machine from the OT department. So you know what, it counted. I don't recommend it, but it's not, it happens sometimes, and it's not something to panic about. But that's definitely something. I mean, the more experiences that you have working with individuals in some form of a helping field, whether you worked in a camp for kids with special needs, whether you went once a week to help a single mom bathe her kids, any of these type of things, they show your character and they show that you care. Definitely you need those 40 hours or whatever the number is with an OT. And whoever asked the question about COVID wise, yeah, it's very hard now. But I do think it is opening up, and I'm not going to get on any side of the vaccine issue, but I do think if you're vaccinated, it's easier for people to take you. But in terms of, I would, on your application, I would write any and all things that you have done, whether, like I said, whether it's just helping out people and, giving it some name, but it's definitely beneficial.
Okay, are there any other questions?
Okay, I do have one more in the chat, unless anybody wants to speak up now, because we do have time for one more. And I guess this for everybody, just real quick, how many years did each of you spend in graduate school?
All right, so Elizabeth 2, Danielle 2.
I want to preface this by saying that I did my second undergrad, which was in nursing, in 1 year, which was ridiculous. It was an accelerated program, and then I spent 5 years in graduate school for a program that should take 2, because I just decided I'm doing it as slow as possible.
And I guess PT is 3 years, right, Michael? and
Yeah,
Elaine?
3 years.
3 years, yes, after count.
There was one thing that hasn't been asked, but I know a lot of people ask me this question, so I'm going to throw it out there if that's okay, Todd, or
Please.
Jeff. Or a lot of people ask me about the difference between OT school and OT assistant, a CODA school. I know people also talk about this with PT and PT assistant. So if anyone has any particular questions on that, we can answer it, but it's definitely a different route. If possible, I always recommend the OT route, the OTR route, as opposed to a CODA. But if anyone has any questions about that, I'm happy to answer it.
I want to add one more thing about graduate school specifically. If you are working for a major health system, definitely reach out and find out what the education benefits are. One of the reasons why it took me 5 years was because I wound up leaving graduate school without any payments due for graduate school. The hospital paid for the entire thing. So a major benefit of doing that is you, for certain people in the health system, they'll pay for the whole program for you.
Yeah, because that's a lot of times when students study to become a nurse practitioner, they're working in a hospital system. The hospital will pay for their tuition, right? Right, Jason?
Yes.
Okay, are there any other general questions?
Yeah, can I ask one last question? Sorry.
Leah, go ahead.
So would you say that in a hospital, the job of a nurse practitioner and a PA is kind of the same?
It probably depends on where you are in the hospital. Certain departments will hire NPs for certain jobs, and some of them will hire PAs. And so it really probably just depends mostly on the department. My department is mostly just PAs. There are NPs, at least in my hospital, or mostly, like I said, like palliative care. They do a lot of the diabetes education. They do. We have some like the GI team hires NPs. A lot of the ones that they kind of want to be able to work more independently. The PAs are more. It happens to be like I have a pretty independent day. The doctor will go do their thing, I'll do my thing. But that's sort of how it will sort of break down in a hospital, at least my hospital.
Right, and conversely, in my department, I have no PAs and I have all NPs. So it just depends on where you go. Doesn't mean one's better than the other. Seriously, there's nothing to read into here.
Thank you.
Oh, and also, I always get this question too, and the student asks this. You have to major in biology to pursue, I know we've had OTs who major in studio art or, but students always ask, do I have to be a biology major or a science major to go into, nursing, PT, OT, PA? Well, I know Jason was a business major.
If you want to go into it directly, sure, it would help. But if you change your mind later, you don't have. You can do it through postbacks. I mean, it's not a big deal.
A lot of the time, it's just convenient because you have all these prereqs anyway, so you might as well just overlap them with your major. So just sort of, and it's also your area of interest anyway, usually. So that just kind of ends up working out. But if you have another area, that's great.
So a lot of the OT students I find are psychology majors.
Yeah, for the OT prerequisites, you have quite a number of psychology coursework that you need, and also you need anatomy and physiology. In order to take anatomy and physiology, typically you need Bio 1, Bio 2, all with the lab. Some schools require chemistry, some require physics, some require neither. But that's also, I was a bio major, mostly because I had all these prerequisites to take. I just finished a major anyway, a minor, I should say, not a major. But like Liz said, they're filling your prerequisites, so it tends to be that way. But there are plenty of people, and it doesn't, and I would not say it looks bad. I would say it actually looks good. It makes you look well-rounded when you're applying to OT schools, at least. There were plenty of people that were musicians and went into the field because they had experiences working with people who had injuries and they wanted to help musicians. So they particularly, wanted that, or sports medicine because of their experiences in sports or whatnot. So I would not say that the major is as important as filling all the prerequisites and having it a decent GPA.
Okay. And Michael and Helene, you were both biology majors?
Yeah, I think for sure, being another major can be an asset in some aspects, but it just makes sense. There's a lot. PT, you need physics and chem and bio and some higher level advanced bio courses. So it just it makes sense.
Yeah, definitely makes sense. And is our my biology. So
All right, are there any other questions? I think everyone has our email addresses if you want to send us a question.
If anybody missed it in the chat, we're going to be sending out a survey to the students tomorrow just to get feedback. We do it for all our Career Center events because we value the feedback. I'll include everybody's email address in that email to all the student attendees as well. So if anybody thinks of anything overnight or tomorrow, whatever, I'm sure everyone would welcome you reaching out to them.
And I'm sure you might get some questions about whether there's any shadowing or volunteer opportunities where you're working right now. So it's been hard, like one student said, because of COVID to find hours, so, no pressure, but I'm sure there might be a few questions in that area.
Yeah. Anyone knows if I can find an internship, please?
Well, it's harder in a hospital setting, right? It's usually easy to get hours like in a private practice, I believe. That's been my experience.
If I could just say one thing, I mean, pre-COVID at least, in terms of finding shadowing opportunities, it's really hard to just like cold call people and then like they'll kind of get back to you. Maybe like it's also hard sometimes for people to have a student and have to go through, especially hospitals have a lot of paperwork and it's to go through all that. So I do recommend maybe volunteering in the emergency room. And then maybe like once you're there, like walk over to the PA, the PT and be like, hey, do you mind if I just like follow you for a little bit? And like it kind of establish that relationship. I know like COVID sort of makes that harder, but if you can find a hospital that's willing to do it, or maybe once things calm down, I don't know if someone's a freshman here and then in a couple of years, or so that's kind of a good way to, and then like all the paperwork is sort of taken care of when you're a volunteer. So you're just like, okay, just can I just follow you? Like it's a lot easier to break in that way.
It's a good idea.
It's a great idea.
Thank you so much. I will do that then.
Okay. Are there any other questions? Any students have questions? All right, so let's all thank our panelists for taking time from their busy schedules to talk to us tonight. We really appreciate it, and it was nice. I know Elizabeth, Michael, and Helene from Stern, and I met Michael when he was applying to PT school, and it's been nice to meet Jason and Danielle. And again, thanks to everyone, and it's good to see everyone.
Okay, thank you so much. Take care, everyone.
Thank you.
Thank you, everybody. Bye-bye.
Thanks.
Thank you so much. Bye.
Bye.